Alors vous allez avoir le douteux honneur de m'entendre parler anglais avec le deuxième témoignage qui est celui d'Amit Kumar de Light Lab, Targeted Therapeutics. Please join me on stage. Amit, welcome to the DEEPTECH Tour. Please have a seat. The blue one, if you will. How are you?
I'm fine.
You're not coming from far. Your lab is just upstairs.
Just upstairs, yes.
So no excuses for being late, but
No.
You're not late, so everything's fine. Just to start this conversation, tell us a little bit about yourself, where you came from, and that sort of things.
Yeah, so I'm from India, and I born and brought up in India, and I did my graduation and master from India, one of the university there. And after finishing my master, I began my career with one of the biggest pharma industry as a scientist. And then after I moved, I changed the company. I changed the profile a little bit, and then I started to work in a CRD properly. Then I got motivated from my other colleagues who were more seniors, and they asked me, okay, come, Amit, it's not the life here. Then you have to move. You have to go for the research and go for the PhD, either do here or wherever you can find.
You were pushed to
Yes,
the PhD by your colleagues,
yes,
right?
by my colleagues, yes, especially by my colleagues, and thanks to them a lot. So then I started to apply for the PhD. And luckily I got one chance here from Paris University under supervision of Dr. Peter and Professor Amit. And I moved here in 2015.
2015, so
Yes.
7 years ago.
Yes, 7 years ago.
You do speak a little bit French, don't you?
Un petit peu.
Un petit peu. You had a dream back in India, as you told me, that you wanted to work in pharmaceutical industry,
Yes.
and perhaps build your own pharmaceutical industry in a way.
Yes, because at one stage when you start a career in industry, as a scientist, so at certain time period that it reached to the plateau. You can reach with the money, but you cannot reach with the position, and you need something extra, extra like PhD or some management degree or something like that. So that was the aim, to do the PhD and go back to the industry and get higher position and work with a big team and grow more and get more money, of course. That was a dream, and now things big change.
Yes.
After coming back here. It's entirely different.
What were your researches on? What was your subject, and what are you doing now with this?
For the PhD.
Did you do the switch?
Yes, for the PhD, because I'm a chemist, organic chemist, okay? So for the PhD, our aim was making work on the targeted drug delivery. So as a chemist, we started with some organic molecules, that our in-house molecules that we developed, some redox sensitive. And then with the other collaboration, because this was the project with the ANR funded, we moved towards the polymer chemistry, and then after we modified them in the self-assembly, those kind of nanocarriers self-assembled into a specific morphology and capable to encapsulate many kind of drugs, bioactive molecules, large molecules or small molecules. That was the whole PhD project. That was the aim to do, and then we did it.
And when you did this, you thought that maybe you could start something with this? Start another thing, that academic career or a pharmaceutical career?
Yeah, actually, end of my PhD, and my boss, and we talk about it, and he said, so what next? And then he said, oh, next there's a huge thing behind it, and then let's move forward, let's make it commercialized, let's work on it more, and then let's find out something that we can sell, we can go to the market, we can reach. So that's how it's began, end of my PhD. But because in the beginning, it was the aim to go up to here to make nanocarriers. We didn't know whether we will succeed or not, but we succeed, actually.
So you were helped and pushed by your
yes,
colleagues,
motivated,
and,
yes, yeah, for sure, yeah.
And co-scientists, right?
Yeah, of course.
It's not always the case.
It's not only me. There are many other people behind me.
So targeted therapeutics are a way to increase the efficiency of existing
Many
molecules,
things,
right?
Many things, not only increase the efficiency, bioavailability, we reduce the toxicity, we increase the dose, and a specific, like a target is specific. It's not only like organ-based, we can reach up to the cells as well, actually, for the treatment of few disease.
And the result is today, Light Lab, Targeted Therapeutics.
Targeted therapeutics, yes.
You found the name?
We are working on it.
It's not the definitive name.
It's a beginning of the project, actually,
Okay.
but yeah, we will reach there.
We were talking just a few minutes ago about iphd.
Yeah.
You did this
Yes,
too.
that is like one more step in this ventureship that I put forward. And
And what has it brought you?
So in 2018, when I finished my PhD, after we came to know about the DEEPTECH founders, and the DEEPTECH founders was a short-term course, like how to be an entrepreneur and how to deal with this all administration and develop the ecosystem and many other things like we don't know, because we just have the small laboratory here.
Yes.
And then to go out, we can go out by the train, and to meet the people with that we don't talk, you know. So to go out, we need some platform, and the DEEPTECH founders was the first platform for us that who again motivated us, and then, you know, to go further. And then we connected with the CNRS. Then we had pre-maturation funding with the CNRS.
CNRS Innovation.
Yes. And those people, we find out the program is iPhD, and then I applied for that, and luckily I got it.
And you did this?
Yes.
You were a
Yes,
laureate
it is going
of
on
iPhD.
right now.
It's still
Yes,
going on, right?
It's going on, yes.
And what has it? What have you learned in, especially in iPhD?
Beyond science, a lot of things that I even can't dream about it. As I told you, I was in industry, and then there was some different atmosphere, and this is entirely a new world for me and for us, actually. And every day is a learning, and science is something that I can discuss, you know, with my colleagues and all. And then when we go, like, talk to people like you, you know, you are there, and there's another channel opens for us. Another strategy is open for us. Okay, now we have all these data, results, and everything, and then how to reach to the people, to the society, or to the system that where we can really, to implement those things. We can publish articles, we can publish patents, many things, but still it is far away from reach, actually.
So it has opened your mind to
Yes.
many subjects.
Yes, true. It opens, yeah.
Are you impatient? Are you an impatient person? You wanted to work it now and not tomorrow?
It has been now almost after PhD 3 years, and still having patience, and then trying to keep myself in, you know.
So because you have to be patient to work in the medtech or deep tech industry.
You have to keep patience a lot. Either, you know, it's every day. It's like a digging a well. You know, you're digging the well, and water is coming, and you're drinking. And if it's not digging enough, there is no water for you to drink. You know, that's how it is going on.
When will be the first human testing with your
if you are lucky
Therapeutics?
enough, maybe in 1 year or 2 year maximum that we can reach up to there. So, but before that, there are many types of preclinical trials are going on in the different laboratories, very big platforms around in the France, actually.
1 or 2 years, it's like tomorrow.
We are targeting, actually. We have to be there, yes. We have to be there, yes.
Well, thank you, Amit.
Yeah, thanks a lot.
Thank you for sharing.
Thank you.
A round of applause for Amit. Thank you to him.